We've had quite a few cases within the region, and based on the statistics given up until yesterday, a total of just above 1.3 million cases positive. And the majority of those cases would have come from the United States, from Mexico, from Canada. We do have within the chain of islands quite a few cases within Trinidad and Tobago and Jamaica. The number of deaths we've had within our region are also quite high. So we have about 79,000 thereabout deaths so far. And as for the number that we have who've had diabetes, it's quite difficult to get that information from the individual countries. However, a few countries have given us estimates, and so that would bring the total number to just under 40,000 deaths of people who are living with diabetes. Some seem that people living with diabetes are doing the best that they can in terms of stocking up on medication and trying to avoid going out in public. We have been in touch with many of our members, and they have been giving us some positive information, sending some videos to show that they're maintaining social distance, and they're also wearing masks as recommended by the particular governments, and trying their best to keep us healthy as possible. So we know that it's a challenging situation, and I believe that there may probably be a need for mental health assessments and care, but overall people are doing the best they can. We've found that the COVID-19 does not respect any age group per se. From the reports I've seen, there have been people as young as newborns and infants who've contracted the virus, and much elderly people who've also contracted the virus. In terms of the severity of the illness, that has been a different story. So, of course, data is still not forthcoming to give us exact details, but in fact, what we do have here shows that people who do have comorbidities, people who have the older age group and people who fall into the high-risk groups have either succumbed or experienced a really bad case of the COVID-19. What is done within the countries is determined by the government and the COVID-19 task force. So from what I've understood, many of the private offices have been ordered to be closed down for a certain period when they experienced shutdown of the country to try to contain the virus. And that has had an effect on the number of cases, I believe, in each country. The governments have also set up respiratory clinics. So you find that the healthcare professionals, especially those in the private setting, have left their private offices and gone into helping the government and helping the country to fight the virus. And there's been a shift in the focus from all the general medical issues to really trying to contain the COVID-19 situation. Respiratory clinics have been set up, and hospitals have gone into emergency mode to take care of emergencies only. The clinics within the communities are still open. The shutdown from many of the countries was only periodically, and not every country has done that completely. So you still have private offices open. You still have certain areas where people could get access to the medical care that they need. So, of course, it varies on a case-by-case basis and which country we're looking at. But people with higher risk or poor outcomes, I believe that they can get the care, but because of the entire situation, there's been a delay in everything. Like, that has caused issues with getting access to medication as quickly as you used to before. And also you have the case where people probably would have delayed anyway to get to the to the physicians or to get to the healthcare facilities for care. So now with the requirement to stay home, I believe that has slowed it down even further. So the role of the nurses and support staff have been very important. They have been optimal in helping maintain control, helping maintain structure. The nurses have a lot of contact time with patients. They're the ones who are always there to make sure that things are done well within the clinic setting and the hospital setting. So they're very important. And without the nurses, without the support staff, people providing food especially, I don't think any of this would be possible. I think the system would be broken. Every country has responded similarly in a slightly different way. So some countries, I believe, based on what they've done, they've had better outcomes than other countries. So you have some countries who've not had a positive case in over 30 days, and you have some countries who have had a continuous rise in the number of cases as time goes by. Now, one problem that seems to be plaguing every single country within this region is the availability of testing. So without testing, you cannot know really what number of cases you have on island, however, or country. However, given the resources available, given the structures and given the procedures that have been followed, I believe that they've been doing as best as they could. I'm extremely pleased that most of our pharmacies have been able to maintain supply, which is good because patients who need prescription refills can obtain what they want. There are some countries who have had few minor issues and some have been resolved, some are still evolving, but for the most part, most countries have access to the medical supply. So I think the pharmaceutical industry has been working well to make sure that countries still maintain the supply of the important medication that is needed for maintenance of diabetes and also the supplies that are needed. Our member associations have also been playing a part in ensuring that the members have information, the correct information, which we felt was important at the start and still continues to be of high importance. People are receiving information from all different sources about the coronavirus, and it is just not true. So the member associations have been transmitting the correct information and ensuring that we direct people to the correct sources to get that information so they could keep up to date. There have also been many webinars that member associations have taken part in, where they've been instructed on updates about the coronavirus and how to maintain their surroundings. Simple things like how to take care of your mask and how to clean your surroundings in your house, how you should open your door, how you should go outside if you need to, what you should do if you go to the supermarket. So a lot of that information is circulating. And I believe that our member associations have been doing well in ensuring that information has been transmitted. I believe that this COVID-19 situation has really forced us to think about the way that we offer medical care to our clients, our patients, especially people living with diabetes. We are now under some sort of quarantine, and you need to get care to those people who need it. However, you also do not want to spread the virus to someone inadvertently. So there may probably be an increase in telemedicine services. That's what I think might happen. And we may probably increase in the number of training sessions we have for patients so that they could do a lot of self-care. I see that's probably the direction that we're heading. Of course, that may be costly, and being able to attract funding for that kind of thing may probably be difficult, especially now. It seems that the funds are running out everywhere, and I'm not sure if our usual funders will be able to continue to fund this kind of venture if that's the situation. I'm hoping that there's still some money in the pot to help people, because the issue with diabetes and its complications, with or without COVID, will still be there. I'm expecting that the confinement that has been done will delay everything, and people who normally would seek medical care maybe a week or two after the issue has evolved may probably now wait 2, 3 weeks, 4 weeks to seek medical care. So that is a new dynamic that may cause more problems for us and more problems for the patient. I think that this is very serious, and we need to start thinking about it now, ways that we could mitigate so that when the COVID situation does disappear, that we don't end up with a sudden surge in the number of complications from diabetes.